Hi, I'm Dr. Vijayant Govinda Gupta. I am a penile implant surgeon in New Delhi, India. And today we will talk about recovery after a penile implant. And if you're getting a penile implant in India and are traveling from abroad, how to plan your stay and how to plan your travel into India. So penile implants are basically prostheses that are utilized for men with refractory erectile dysfunction. That means men who are not able to have intercourse with medications. An implant provides them with the ability to have proper sex. As you know, I am the largest volume penile implant surgeon in New Delhi, India, and a lot of my practice or my patients fly in to India from abroad. Even if you're listening to this video from India, this will help you travel to Delhi for the implant and will help you understand how much time it will take for you to recover after a penile prosthesis. So let's start. So the penile implants can be of many types. So there are usually three types of implants: the malleables or the rods, in which we do not have a pump in the scrotum or we don't have a reservoir, and then we have the two-piece or the ambicor, in which we only have a pump, we do not have a reservoir, and the three-piece, which is the gold standard implant, which has a reservoir and a pump. So the penile implant, as you understand, the lesser the amount of components, faster the recovery. So the fastest recovery is seen in those patients in which we put in a malleable, because in this there is no extra dissection required to put in the pump or the reservoir. So these men are able to recover the fastest. Whereas the men who have a reservoir and a pump, their recovery is fast in terms of functional recovery, like they can walk around and they can sit and everything, which is as good as the malleables, but they require some more time to understand or to be able to utilize the pump and to be able to pump and cycle their implant. So usually before we put in an implant, we need the patient to be stabilized. Stabilized in the sense that if the patient has diabetes, his diabetes needs to be well controlled. If the patient has any cardiac diseases, then his cardiac status needs to be well controlled. If the patient has hypertension or the patient is on any cardiac medication, then those medications need to be optimized before the patient goes in for the surgery. This ensures adequate recovery, proper recovery after the implant, as well as prevents any complication other than related to the implant placement. So if you are a diabetic or a hypertensive or a cardiac patient, then it makes utmost sense for you to communicate this to me before you fly in to India. So what most patients do is that on the initial email communication or on the initial verbal communication, we usually ask the patient for all the list of all the medications they have been taking, and we make a list of the common comorbid factors like body weight, height, any cardiac medication, any diabetic medications, and then we screen them through to our resident physician, and based on that we would ask the patient either to optimize it in the home state or the home city. If the patient does not want to do that, we usually call the patient in 3 to 4 days before his desired date of surgery. In these 3 days, we will get the patient evaluated from a physician and from a cardiologist and from an endocrinologist. These are all in-house, and we are able to perform all the tests, like if you require an echo or if you require any of the blood tests. And based on that, we usually change the medications or optimize them so that the patient has good blood sugar levels, good cardiac function, and good blood pressure before he goes in for the surgery. The surgery is usually performed under spinal anesthesia, so that ensures that the patient is awake and the patient is able to walk 2 hours after the surgery. But if desired, the surgery can also be done under general anesthesia on specific requests. There are instances where we have placed implants even under local anesthesia. My initial training was done under local anesthesia, but a local anesthesia may be a little uncomfortable for some patients, and since anesthesia costs are not very expensive in India, we usually prefer to put the patient to sleep, or at least give the patient a caudal block so that the surgery can go smoothly. A rapid surgery time along with local anesthesia infiltration ensures that the patient has minimal pain in the post-operative period. Our patients usually do not complain of post-operative pain and are up and about on the same day of the surgery. We usually do not place a Foley's catheter. The patient can pass urine at the same day of the surgery. So after the implant surgery, you are on the bed under monitoring for the first 2 to 3 hours. You are started your fluid. So usually our implant surgeries are done early in the morning. So by the afternoon, you can start your diet, you can have something to eat, you can start walking about, and you can pass urine. So you are independent and able to take care of yourself within a few hours after the implant surgery. Pain is usually minimal, but if there is some pain, we usually give you ice packs and some painkillers to take care of the pain. An implant surgery can always have some soreness, but the soreness is never so much that a patient is screaming in pain. The patients are usually able to manage and are able to take care of themselves. You will usually stay in the hospital for the first 2 days, but if you're a diabetic or a hypertensive, we would like to keep you in the hospital for 3 days. We have private single rooms for your comfort without much of interference and with adequately trained nurses and staff to take care of you during your stay with us in the hospital. In those 2 days, you are free to move out, watch television. You can sit most of the times while your dressings are done and your blood sugar medicines are continued and your antibiotics are continued. After 2 days, after a dressing has been opened, usually in the inflatable penile implants, we will send the patient in with an inflated implant for the first 48 hours. We will deflate the implant on the 48th hour, and after deflating the implant, we usually discharge the patient with a snug dressing and a total support to go back to his hotel. Usually the pump system is the most sore area after a penile implant, and the pump system is the one that the patient needs to learn. So we deflate the implant and we let the patient rest in his hotel room for the next 48 hours. During this 48 hours, you can utilize that time to travel around in Delhi. You do not need to stay in the hotel room. You can wear your total support, take your medication which are oral in nature, and travel around Delhi and maybe enjoy the sights and sounds. At the end of 4th day, we usually call the patient back in for his dressing, and during that time his sutures would have been healed. We usually put absorbable sutures, so the sutures do not need removal. You can get those sutures removed back in your country and these will dissolve on their own. After 96 hours of surgery, we would usually press the pump and we would cycle the implant for the first time. Most patients find it a little uncomfortable, so we can usually pump the implant once and then send the patient back to his hotel for another day. Usually after 5 days of the implant, the patients are comfortable enough to start cycling their implants on their own. The patients are taught how to reach their pump. The patients are able to understand how to inflate it and deflate it. They are taught about the deflation button and they are taught about the inflation pump, where the patient is allowed to pump his implant on his own 1 or 2 times and then the implant is deflated. Now the patient is ready to travel back to his country or to his city of origin. Usually we let the patient relax with his pump and his implant for the next 10 to 12 days, in which time the soreness usually disappears. After that, the patient is usually instructed to start cycling his implants. So the patients are able to cycle their implant 15 to 21 days after their penile prosthesis. In cases of a malleable implant, all these steps are not required and the patient can travel back to his home city after 3 days of the surgery. So usually if you are planning a penile implant in India, you need to, in cases of a malleable, you need to be in New Delhi only for 3 to 4 days, while in the case of a inflatable penile prosthesis, you need to be in Delhi 3 days before the surgery and around 5 to 6 days after. So usually a week is enough for healthy patients and 9 to 10 days for diabetics and hypertensives. So a penile implant prosthesis placement is an extremely comfortable surgery. It does not require much use of attendants. You can get it done independently. The pain is not too much, the recovery is rapid, and usually most patients do very well in a week. The entire surgery duration is just 25 minutes, in which you need to be in the OR for just 1 hour, and you are asensate or not able to use your limbs for only 2.5 hours. Apart from that, you are completely mobile, able to take care of yourself, pass urine, and you are able to do your activities freely. So the penile implant recovery process is smooth, especially if done well and especially if done in a high volume center. If you are looking for a penile implant in New Delhi, India, then Govinda Medi Center is the place to go to. You have my contact details in the video. You can always write to me, you can call me up, you can communicate with our patient attendant caregivers to plan your implant surgery in India. Thank you so much.